This video will demonstrate how WoundZipper works on a laceration. The WoundZipper is a patented dressing which incorporates magnets. Both magnets attract to each other. The other side of the dressing has a peel-off adhesive layer. When removed, it exposes the adhesive portion of the dressing, which will be applied to the wound edges. You can see the strength of the two magnets which attract to each other. This will help to approximate wound edges. This patient is a 40-year-old male with attempted suicide via cutting of left distal forearm with a razor blade. The provider is sterilizing the area with betadine first, and then with alcohol. There is no need to apply any local anesthetic, as this procedure is virtually painless. Here is the WoundZipper taken out from the pouch. The first part of the dressing is to be applied. The peel-off sticker is applied directly to the skin at the laceration edge, and this is part 1 of 2. The other portion of the WoundZipper with the opposite magnet is applied to the other edge of the wound. You can see these two magnets will attract each other and help approximate the wound edges. A dressing over the laceration in WoundZipper is optional. It is preferred to apply the dressing for protection of the device. The WoundZipper, however, does not require a secondary dressing. This application takes less than 1 minute to apply. This patient returned to clinic after 5 days and removed the WoundZipper at home. Here is the wound at 5 days. You can see a faint linear scar without staples or suture marks. The patient is more comfortable during the procedure, no anesthesia is required, and the patient can go home in minutes.